Top 10 countries with high drug consumption in the world. Drug consumption is one of the most pressing global issues of our time, impacting lives, economies, and societies in enormous ways. From the misuse of prescription medications to the widespread use of recreational drugs, every country struggles in its own way with this challenge. In this video, we'll uncover the top 10 countries with the highest rates of drug consumption, exploring what drives these trends and the lessons that the world can learn to take meaningful action. By the end of this video, you'll have a better understanding of the factors behind high drug consumption in different nations, how it affects people individually and collectively, and why addressing this issue is crucial for building a healthier society. Without further delay, let's dive in. To begin, it's important to define what we mean by drug consumption. This term refers to the use of substances that alter a person's physical or mental state. These substances can include prescription drugs like opioids, over-the-counter medications taken inappropriately, or illegal recreational drugs like cannabis, cocaine, and methamphetamine. Drug consumption does not by itself indicate substance abuse, but when it becomes excessive, dependent, or negatively impacts a person's health, it transitions into abuse and addiction. Measuring drug consumption in different countries involves looking at several factors, including prevalence of use. How many people, percent in the population, are using a substance? Type of drug. Different countries face unique challenges based on the availability and popularity of certain substances. Accessibility. How easy it is for people to buy or gain access to these drugs. Now let's break down the driving factors behind drug consumption. Drug use is not uniform across the globe. There are unique reasons why certain countries have higher rates of drug use compared to others. Economic conditions. Wealthier nations often have higher levels of recreational drug use due to disposable income, while poorer nations may see higher rates of cheap drug dependency for stress relief or escapism. Healthcare crises. Overprescription of opioids or other medications often leads to widespread dependency. This is particularly prominent in countries struggling with pain management or lax pharmaceutical regulations. Trafficking routes. Nations on or near major drug trafficking paths often face higher consumption due to increased local availability. Cultural norms. Social acceptance of certain substances can result in higher usage rates. Social and political unrest. Communities under high levels of stress, instability, or conflict are more susceptible to drug escapism. With this context in mind, let's begin our countdown of the top 10 countries with the highest drug consumption in the world. Canada ranks among the top countries for drug consumption, particularly due to its opioid crisis and rising use of recreational cannabis. Despite strict regulations, the mismanagement of pain medications has led to widespread opioid addiction. Cannabis use has also increased since it was legalized in 2018, with many turning to it recreationally. Canada is now grappling with addiction recovery programs and improved monitoring of prescriptions. Russia faces significant challenges with alcohol consumption and synthetic drugs like new psychoactive substances, NPS. Limited access to modern addiction treatment programs and growing trafficking routes for synthetic substances are major contributors to the problem. Russia also struggles with enforcement in remote areas, where communities are particularly vulnerable to drug abuse. South Africa has experienced a surge in methamphetamine, TIK, and cannabis consumption in recent years. The country's proximity to international trafficking routes has exacerbated local availability. Poverty and socioeconomic disparities also play a big role in the rise of dependency. Programs aimed at educating the youth and increasing job opportunities are slowly attempting to address the problem. Mexico is one of the world's most significant drug trafficking hubs, being a major conduit for narcotics flowing into the United States. Easy access to drugs like cocaine and methamphetamine within its borders has fueled high rates of local consumption. The drug trade also creates political tension and undermines societal stability. Tackling cartels and strengthening social services are critical steps for Mexico to combat its drug problems. Drug consumption in the UK has grown due to the increasing use of cocaine, ecstasy, and ketamine within its younger populations. Urban centers, in particular, have seen a rise in party drugs connected to nightlife culture. The country also continues to face challenges with the overprescription of opioids like codeine. Awareness campaigns and stricter controls aim to reverse these trends, but addiction management remains a top priority. Germany has high levels of recreational drug use, particularly in its metropolitan areas. Cocaine use is rising steadily, aided by its affordable price compared to other countries. However, Germany also faces challenges with prescription drug misuse, particularly tranquilizers and sedatives. As one of the leading economies in Europe, the government is investing heavily in research-based interventions for addiction recovery. Australia ranks high for recreational drug use, especially cannabis, MDMA, ecstasy, and methamphetamine. Its relatively affluent population and cultural trends have seen a normalization of drug experimentation, particularly among the younger demographic. Government action includes promoting public education campaigns and implementing stricter trafficking prevention measures. The United States has one of the most severe drug consumption issues globally, driven by an ongoing opioid crisis, methamphetamine use, and increasing recreational cannabis consumption. Overprescription of pain medications in the 1990s led to a nationwide addiction epidemic, which has evolved into a significant public health crisis. Efforts to address this crisis have involved pharmaceutical regulations, improved addiction therapies, and community-based rehabilitation programs. As the world's leading cocaine producer, Colombia's rate of local consumption has grown in tandem with its role as a supply hub. The influence of cartels and drug trafficking networks has deeply affected societal stability in the country. Local communities, particularly those near cocaine production hubs, have seen high addiction rates. The Colombian government aims to step up drug prevention programs while working internationally to help reduce global demand. Afghanistan ranks at the top due to its status as the leading global supplier of opium and heroin, which has also resulted in high local consumption. Decades of conflict and instability, compounded by poverty, have entrenched drug use as a coping mechanism for many citizens. With limited infrastructure for addiction treatment, Afghanistan faces significant challenges in combating this issue. The nations highlighted in our countdown offer stark examples of how drug use impacts individuals, families, and societies on a broader scale. Here are some of the biggest global implications of drug consumption. Public health systems. High drug consumption places immense pressure on healthcare systems, requiring significant resources for treatment and rehabilitation. In worst-case scenarios, addiction crises overwhelm available care systems. Economic costs. Beyond individual expenses, drug use comes with broader societal costs, including increased healthcare spending, law enforcement budgets, and lost worker productivity. Social and family structures. Addiction can destabilize families and destroy communities, leading to lifelong consequences for children and dependents. National security. Countries dealing with drug trafficking often see increased crime, corruption, and political instability. These challenges highlight the need for comprehensive approaches to address drug consumption head-on. Despite the grim statistics, there is hope. Countries across the globe are implementing strategies to tackle drug consumption and mitigate its damages. Here are some key initiatives. Awareness campaigns. Educating communities, particularly young people, about the dangers of drug abuse is essential. Addiction recovery programs. Governments and NGOs work tirelessly to expand access to rehabilitation centers and support systems. Better drug policies. Countries like Portugal have experimented with decriminalizing certain drugs and allocating funding to help addicts rather than punish them, and have seen promising results. Strong global cooperation. Trafficking is an international issue, and countries must collaborate on border control, intelligence sharing, and dismantling organized drug networks. Drug consumption is not just a problem for governments to manage. It's a societal challenge that requires everyone's attention. Here's what individuals like you can do to make a difference. Learn more about addiction to understand its causes and outcomes. Support people who are recovering from addiction by destigmatizing conversations around their struggles. Help spread awareness by engaging in discussions with friends, family, or classmates. Together, communities can help shift the focus toward healthier, informed lifestyles that benefit everyone. Drug consumption is a complex and deeply rooted global problem, but understanding its causes and effects is the first step toward finding solutions. The data and stories from the top 10 countries on this list reveal the scale of the challenge, but also point us toward areas of opportunity for change. It's up to all of us, governments, organizations, and citizens alike, to take action and ensure that drug consumption trends do not dominate the landscape of the future. Thank you for watching, and don't forget to share this video to inspire others to think critically about this pressing global issue.